Hello and welcome back. Today I'm going to talk to you about Chapter 17, Reducing Your Risk of Developing Cancer. In this class we're going to talk about cancer, how it develops, its impact in terms of morbidity and mortality, the costs, and how to effectively prevent cancer. We're going to talk about causes of cancer. We're going to talk about different types of cancer and the risks that they pose. We're going to describe some current effective methods for cancer treatment, and we're going to discuss what it means to be a cancer survivor. Let's take a look at cancer. This is an overview of cancer. On the left, you can see estimated new cases. You can see that the cancers of the skin, respiratory system, breast cancer, digestive system cancer, and genital system cancers are the most common. But in terms of death, the most common cause of death from cancer are cancers of the digestive system. That would be the stomach and intestines, primarily. Next, respiratory system. That would be primarily the lungs. Then the urogenital system would be the next most common cause of cancer. In terms of the urogenital system, one of the most effective ways of reducing cancer risk is to get a human papillomavirus vaccination. That will reduce the risk of cervical cancer for women and penile cancer for men. In terms of the respiratory system, reducing lung cancer can be most effectively done by not smoking. And in terms of the digestive system, reducing cancers can be most effectively managed by eating a healthy diet high in fruits and vegetables, whole grains, and fiber. So what is cancer? Cancer are abnormal cells with mutations in DNA that occur over time. And cancer cells will form different structures with different growth rates and have different functions from normal cells. And they will disrupt the function of normal cells in your body. A metastasis is when one of those cancer cells breaks off from a tumor mass and moves to a distant organ, spreads to a distant organ, and then disrupts the functioning of that organ. Metastases are typically what kills people in cancers. At each stage, you can see from hyperproliferation to polyps of small size and large size, to precancerous polyps, to adenocarcinoma, and then frank cancer. Each of these stages, mutations are occurring in DNA as the cells grow and divide. There are certain pro-inflammatory signals that will increase the risk of this process occurring quickly. So reducing inflammation is a key to reducing cancer risk. But mutations do occur every time a cell grows and divides. And this is why cancers typically occur later in life. There's much higher rates of cancer for people over the age of about 55. Here's some cancer terminology. Again, cancer is a group of diseases which are all characterized by uncontrolled growth. There are hundreds of different types of cancers, and each type is different with different mutations. A neoplasm, it just means a new growth. It's a mass of cells that doesn't have a particular function. Neoplasms in cancers are sometimes used interchangeably. A tumor is a mass of neoplastic cells or cancer cells. Malignant means it's dangerous. If your doctor tells you your cancer is malignant, that means it's dangerous and it will progress and potentially will kill you. Benign means that it is not dangerous. There are many situations where masses of cells occur and those cells are in fact benign. They can either be removed or just left in place because they will not turn dangerous and not become cancerous. A biopsy is a process by which a sample is taken from the tumor mass. Typically that would be a needle biopsy where a needle is placed inside of the tumor mass to remove some cells, and then the scientists, laboratory technicians can look at those cells, perhaps do genetic testing on those cells, and determine whether those cells are malignant, dangerous, or benign, not dangerous. Cancer is staged. Stage 0 is when the cells are abnormal but they're in one place and can be easily removed. Surgery is the most effective treatment for most cancers. Stage 1 to 3 cancers, this tumor size is getting larger and beginning to spread. In stage 4 cancer, the cancer has spread to other organs. This is the most dangerous form of cancer. This is the form of cancer that kills most people. So what are some of the causes of cancer? Time is the biggest cause of cancer. Thus, as we grow and our cells divide and are replaced throughout life, mistakes happen. And when those mistakes happen, mutations occur. And when mutations occur, some cells can grow faster. And when those cells grow faster, they can become predisposed to being cancerous. Next, most common would be hereditary risk. We do inherit combinations of genes from our parents that place us at risk for certain types of cancer. And then there are environmental risks, things that we contact that can damage DNA in our environment. We should try to reduce and avoid contact with cancer-causing agents. Sometimes those are in foods, sometimes those are in the air we breathe, sometimes those are things that we touch, chemicals, so forth. One of the largest environmental risks for cancer would be tobacco use. Men and women who smoke have a risk of cancer that is 25 times higher than for a non-smoker. But in fact, cancer causes much more death from cardiovascular disease. Even though it dramatically elevates the risk of lung cancer, it even further increases your risk of cardiovascular disease. That would be heart attacks and strokes. And in fact, smoking causes more death from heart attacks and strokes than it does from lung cancer, even though it is the #1 cause of lung cancer. Other risk factors. Diet is an incredibly important component of risk for digestive tract cancers, cancers of the stomach and cancers of the intestines, both the large and small intestines. Sedentary lifestyle increases your risk of cancer. That's because people who exercise produce natural antioxidants, and those natural antioxidants neutralize chemicals that cause cancer. Alcohol consumption. Alcohol can be metabolized into aldehydes. Aldehydes damage DNA, and therefore alcohol can increase your risk of certain types of cancer. Stress, again, elevates your risk of certain kinds of cancers and can increase the risk of incidence of those cancers. Inflammation and cancer risk. 90% of all cancers are caused by cellular mutations and environmental factors, but many environmental factors cause inflammation. Around 20% of cancers can be the result of chronic infections, things like the human papillomavirus, for which there is now an effective vaccine. 30% of cancers are the result of exposure to factors like tobacco smoke or particulates like asbestos. In fact, I would suggest that you avoid breathing in dusts of any kind or sprays of any kind, even sprays for sunblock or so forth. I would avoid breathing anything in that's particulate in nature and can coat or damage your lungs. Vaping, again, is another example of something that I would avoid because of the damage that it can do to your lungs. 35% of cancers are actually due to dietary factors, particularly cancers of the colon. To reduce the risk of colorectal cancer, it is important to feed your microbiome a healthy diet of fruits and vegetables and whole grains. Some environmental risk factors are asbestos, very dangerous. Asbestos causes a particular type of difficult to treat lung cancer. Heavy metals like nickel or chromium can cause damage and predispose you to a risk of cancer. Chemicals such as benzene or arsenic or vinyl chloride are very damaging. Coal or tar or radioactive substances or any kind of inhalant, some pesticides and herbicides can be risk factors for cancer. Exposure to radiation is a cancer risk. And carcinogens, particularly carcinogens found on food like barbecue or burnt substances, can be risk factors for colorectal cancer. In terms of infectious disease, hepatitis viruses can predispose to liver cancer. Human papillomavirus can predispose to cervical cancer and penile cancer. And Helicobacter pylori, found in the stomach, can cause stomach ulcers and ultimately can cause stomach cancers. Some medical factors that elevate your risk: estrogen and progesterone supplementation post-menopause can contribute to cancer risk. Chemotherapy, chemotherapeutic agents, whilst effective for treating cancer, can predispose to secondary cancers later on in a person's life. And treatments such as X-rays, when used in excess, particularly CAT scans. CAT scan is when multiple X-rays are taken through sectioning through a person's body. Those sorts of scans do carry small but measurable elevation in risk for. Let's talk about lung cancer. In 2018, there are an estimated 234,000 cases, and 155,000 Americans died of lung cancer. Fortunately, there are now some more effective treatments for lung cancer that are very new, that are becoming available, and so those numbers are starting to decline. A lot of women die from lung cancer. It is now exceeding the number of women that die from breast cancer, in part because the breast cancer treatments are so effective. Symptoms that you may see with the onset of lung cancer are persistent cough, hacking cough, coughing up blood, any kinds of chest pains. So things that should get checked by your doctor rapidly. Treatment. Surgical treatment is very effective. Radiotherapies are often used, and chemotherapies are often used. But most recently, there have been dramatic improvements in targeted biological therapies, antibody therapies. Typical antibody therapies remove the brakes from your immune system and allow your immune system to attack the lung cancer. Those therapies are improving and becoming very effective to treat certain lung cancers. Most important is to avoid smoking, avoid environmental tobacco smoke, and to avoid exposure to asbestos. Breast cancer, there were 266,000 cases of breast cancer diagnosed in women and 2,500 in men. About 1 in 8 women suffer from breast cancer. Current cure rates are above 90%, approaching 95%. Detection involves mammograms. It's recommended that women over the age of 50 get regular mammograms. I would note that there is a high rate of detection, false positive detection in mammograms. So if a mass is detected, many times that mass is benign, not always, but do keep that in mind. It is always good to do self-examination, check the breast for any lumps or irritation, distortion, tenderness, and get those things checked by your doctor as quickly as possible. Breast cancer is a disease that can develop rapidly, and the sooner you treat it, the better. Risk factors. Family history is a big risk factor for breast cancer. If you have women in your family that have suffered from breast cancer at an early age, particularly under the age of 40, I would consider getting checked to see if that is a genetic risk factor for you. Treatments when lumps or cancers are detected involve removal of the mass, sometimes mastectomy, radiochemotherapy, and biologic therapies. which these forms of therapy are very effective today. Colorectal cancer, particularly important cancer. 97,000 cases of colorectal cancer every year. Nearly 50,000 deaths. It has a very high, very rapid death rate. Colon cancer is increasing in younger people, unfortunately. Therapies include radiation, chemotherapy, and surgery. Currently, we do not have very effective biological therapies, although I'm sure that will change in the coming years. Obesity is a risk factor. Family history is a risk factor. Diets that are high in fat and low in fiber are a big risk factor. Smoking is a risk factor. Alcohol consumption is a risk factor. And lack of exercise is a risk factor. Skin cancer, about 9,000 people suffer from skin cancer every year. Sun exposure, particularly sunburns, is the biggest risk factor. The most deadly form of skin cancer is malignant melanoma. If you have dark, irregular moles, please get those checked quickly. It is important to get melanomas treated as rapidly as possible. Rates of melanomas are highest in women below the age of 50, but increase for men over the age of 65. If the mole is asymmetric, has an irregular border, is dark or not uniform in color, and particularly if anything that is larger than a pea, get that checked rapidly. Here are some examples of what malignant melanoma on the left looks like. In the middle is a basal cell carcinoma, much less dangerous, but nevertheless something worth getting treated. And a squamous cell carcinoma, again, much less dangerous than a malignant melanoma, the one on the left, but nevertheless something that should be treated. So to prevent skin cancer, avoid exposure to sun in the middle of the day, particularly if you're fair-skinned, and particularly if that exposure will cause you to burn. Burnt skin is a sign that DNA damage is occurring. Be careful with sun protection, to use sun protection that's appropriate for your skin type. And be very careful if your family has a family history of skin cancer. Prostate cancer is male cancer of the prostate gland. It is one of the more common forms of cancer in men in the United States. About 164,000 cases are diagnosed. About 1 in every 6 men will be diagnosed with prostate cancer. It can be improved. The outcomes can be improved by early screening and early diagnosis. 5-year survival rates are very high, but advanced cases can become very difficult to treat. This is an example of a prostate with a cancer here on the right-hand side. You can see how that cancer is invading the surrounding tissue. Some symptoms that may occur is difficulty urinating, blood in the urine, sometimes lower back pain if the cancer has moved into the lower back. Risk factors: age, poor diet, and lifestyle, sedentary lifestyle.